a little bit of my things correct, and take this out of the picture. And now that I see you, Amanda, this morning I was on el programa La Mañana.
Sí.
Con Telemundo. Sabes que yo hago el segmento por la mañana, hago el segmento con el doctor Lovelo.
Oh, perfecto, ok.
Sí, estamos todas las mañanas a las 8:33. Mañana de nuevo ya tenemos el guión para mañana. So, and I think they wanted to talk a little bit about steroids as well.
Yeah, no, we'll do it in English first, and después we'll do it just in case for Telemundo local, like Telemundo 51, and we'll be good.
That's fine. So shoot whatever you want. Okay, we're here.
All right, we're good. All right. So I already know your name, but yeah. So just tell me a little bit. Obviously, this new analysis came out. They published it in the Journal of American Medicine, or JAMA. What do you think about it? Do you think you're in the ER every day? So tell me about whether you think the study is relevant, good. What do you think?
Well, yeah. I mean, the value of the steroids to treat patients with COVID-19 has been definitely backed up by scientific evidence. So we started having a couple of small trials that were differently produced in China and also in the United States, and then came in with a large British study that was published at The Lancet. And that essentially opened up the eyes, or essentially came in to reverberate the value of the steroids to treat the disease. Now, I think the newest analysis is nothing really completely new. It's more again, another backup of the evidence that we have. And it came to tell us that, yes, the use of steroids is indicated, as we already knew and as we already were doing. And I think it's definitely of great value for the scientific community to have this evidence supporting what we do.
You've treated patients since the beginning of this. Have you seen effective treatment with the use of these steroids?
Since the very beginning of the treatment, we have initially conflicting evidence. I'm talking about the latest days of February or the beginning of March. And at that time, we realized that the use of steroids were beneficial. So we actually added the steroids to our armamentarium from, I will say, the very beginning, and we have observed significant improvement with those. Again, I want to highlight the fact that neither steroids nor any other treatment that's available at this point is the cure for the disease. It's a great adjuvant therapy. That means it's a great help on the treatment, but it's not really the cure, and that's important to transmit the message that way.
No, 100%. Yeah, and I already have it written like that. But also, when is this used? Is it mostly for critical patients when they're in the ICU? Like, at what point do you decide, okay, we're going to go switch to the steroids?
What we have seen, and I think what's really reflected on the different studies, is the use of the steroids seems to be beneficial for patients who develop respiratory symptoms. And when I'm talking about respiratory symptoms, I'm talking about the need for oxygen, and or coercive cough that's really causing significant problems breathing. And those are the patients who really start getting the benefit from the steroids. I think an attempt has been done of using the steroids for every patient infected, and I want to maintain the caution about this, because the studies have shown no benefit unless you have respiratory symptoms. And I think this is very important, because some of the studies even have shown that using it in every patient, every person who gets infected, could actually be harmful for some people. So got to be very careful. And another point that I really want to highlight here is that every treatment needs to be done in coordination with your healthcare provider. I don't think we should be taking medications with no, I won't say authorization, but I'll say the advice of your healthcare provider, because that's really the person who is going to indicate whether this is really adequate for you or not. And again, caution on that, because not everybody gets the benefit from steroids, and it could actually be harmful if you don't do it correctly.
They cite mortality rates, how it improves that. What have you seen, based on your experience?
So steroids typically have in patients with COVID-19 have shown to reduce the effect of the respiratory failure. That's essentially translated into an improvement on oxygenation. So your oxygen level gets better. and also the ability to get you out of the supportive machines. And I'm talking about a ventilator or even any other help for breathing, such as a BiPAP machine or a high flow oxygen. This is to be reduced. So again, so this improvement in that sense. And also there's been a reflected improvement on mortality on the patients. That's, again, the major reflection of this was the British study, and some other small trials have shown similar results.
You froze a little bit in the when I asked you before about like the benefits or whether you think it's good or bad. Can you kind of reiterate it one last time, just in case as a backup?
Sure. Sorry. Would you want to go back to the whether it's good or bad or what's the effect?
Okay. Yeah, whether it's good or bad from your perspective.
Yes. So the effect of the steroids. Give me 1 second. The noise is too much here.
No worries.
Hola, Alice. Give me 1 second. Hola, Alice. Estoy en tele. ¿Puedes cerrar la puerta? Give me 1 second. We have a party here.
Oh, I know how it is. You're in a busy hospital. I'm home. I have my dog in the
right. People working everywhere. Anyway, now we close the door. Sorry. So the thanks God is, I mean, everybody knows here that 8:33 is the time on live TV, so no one shows everywhere, right? And they keep it like 10 minutes, but this was unexpected. So anyway, all right. So let's go back to express a little bit about the
froze a little, so I just want to make sure.
Yeah. No problem. So the effect of the steroids from the very beginning, we observed that it really is beneficial for the oxygen level of your patients with respiratory failure. So you give the steroids and those patients require less oxygen. Also, the time that they spend on supportive care, and when I'm talking about supportive care means a respiratory machine, a ventilator, and or any other device that helps to breathe, and those are shortened by the use of the steroids. And finally, from the British study, we have conclusive evidence that the steroids decrease mortality as well, compared to those patients who do not get the treatment.
Perfect. ¿Ahora español?
Sí, perfecto.
Well, si alguien está viendo, tu nombre, apellido y título.
Perfecto. Soy el doctor Javier Pérez Fernández, el director de los servicios de cuidado crítico del Hospital Baptist de Miami.